In the ever-changing world of healthcare, are you looking to get advice and learn to prepare for healthcare challenges that you may face? Come join a conversation about all things healthcare and wellness with your hosts, Gavin Wiswell, Dr. Guillermo Castillo, and Dr. Monsi Shaw.
Welcome to the Healthcare Corner, everyone. And today, I think, is an episode in the making that we should have done a lot sooner, right? We've had so many great topics on the show, ranging from health and wellness and even different types of companies and things that we've had. But we've never really focused, I think, on women's health. So, Guillermo, I'm so glad that we've got Dr. Monsi Shaw helping us out every week. And Monsi, I know we've got an exciting guest today that we're going to talk about PCOS. And what that is in women's health, so polycystic ovary syndrome. So, Guillermo, Monsi, we're so excited today. How are we doing today?
I'm doing great. It's good to hear you, Monsi. I wish you were here with us in the studio, but it's good that we have you on regardless. So, how have you been?
I've been great, and I am so excited to do this episode, guys, because we have a powerhouse practitioner on board today. Guillermo and Moose, you guys read the bio, right? With this doctor here we have.
Yeah, absolutely. I'm excited to hear everything she has to say. So why don't you go ahead and introduce her and tell us what we're going to hear about today?
Let's get into it. Absolutely.
Absolutely. So Dr. Ayam, she is into wellness and as well as wealth. So she's a functional practitioner certified as a drugless practitioner board, and also licensed financial broker, podcast host, author, speaker, and investor. And the list goes on. So as a wealth expert, she likes working with professionals and business owners, optimize their wealth and build something that they can leave legacy with. But on the other hand, when it comes to wellness, she's very passionate about women's health, and that's why she talks about polycystic ovary syndrome. As her journey unfolds, we're going to talk more why she picked this. She's very passionate about helping women, and she is committed to helping them with better health. And, she understands the importance of it because she's gone through stuff herself, and that's how she's gotten into this. And for her hobby and for her own mental health, she spends time with her family and time blocks so that she can spend amazing time with her 3 wonderful kids. So welcome, NDD, and we have Dr. Guillermo and Gavin here, so why don't we give her a warm welcome, guys. Let's get started with getting into women's health.
Excellent. Welcome, Ndidi. Glad to have you on the show.
I appreciate it. Thank you so much. I'm glad to be here.
So this topic is one that I think affects more people than we know. I didn't realize that it affects 6 to 12% of U.S. women reproductive age, so up as many as 5 million people. The CDC says that this disease really affects that many women, and it goes well past their childbearing years. So is this one of those kind of unsaid things, Dr. Eham, that is out there that we just need to share with everybody and how to proactively guard against it?
Yes, I definitely believe it is. The funny thing with PCOS, or let me not say it's funny, but the interesting thing with polycystic ovary syndrome is it happens at different stages in a woman's life. So, when a young girl, starts her menstrual cycle, it could be as early as age maybe 12 average. And, women are going through this cycle all the way through to, maybe when they get to menopause. So, and it appears in different forms, right? Maybe for a younger girl, she could be suffering from extreme heavy periods or irregular periods or no periods at all. So, and then a woman, when she comes into an age of time to bear children, it could show up as infertility or miscarriages and, go on and on like that. And some people in between those ages, they're suffering from other things that it might look like insulin, maybe diabetes, depression, anxiety. But PCOS in itself is not a disease. It's a syndrome, which is a combination of, several different symptoms coming together that make it polycystic ovary syndrome. So that's why it's very overlooked, because you might have one part of it and you might not think is, linked to something else that's going on with you. In my own life and in my own story, everything happened at different stages of my life. At first, as a young girl, I would have excruciating pain and severe cramps whenever I was having my period, which went into like severe cystic acne my whole pretty much adult life. And then, problems with, getting pregnant and then losing those pregnancies. It wasn't until later when I sat down, I'm like, something is not right. And I started researching. I'm like, oh, if all of these are happening, it's probably what polycystic ovary syndrome is. So that's why it's really interesting to me, and I felt like I have to help someone else out there that might be confused with what's going on with them.
That's very interesting, Dee Dee. So what you're telling us is that you actually started suffering from this syndrome very early. So when you first, at the onset of your actual menstrual cycles, and it didn't become clear until much into your adulthood. Is that? Did I hear that correctly?
Yes. So,
what do you think was the delay in that diagnosis? Why did it take so long to figure it out?
So for me, I was looking for one of the solutions. I didn't know what the root cause was, what was going on. For me, I was having, the extreme pain when I had my period. It was severe cramps, and everyone around me, I went to all-girls boarding school as a teenager, and I saw other girls that weren't suffering like me. I would be like one in maybe 10 girls that when that time came, I was rolling on the floor, throwing up, like it was crazy. And I didn't see anybody else going through that. And then it turned into cystic acne. So like within like maybe a span of 5 years, it was like a different symptom happening. I didn't group them together until I started researching more. And for me, when I started having cystic acne, my dad was like, oh, it runs in the family. I had it when I was younger. Just don't eat that and wash your face like this, and you should be fine. And my mom would be like, oh, when you have your first child, the acne will clear. Well, I had 2 children and I was still having cystic acne, and I'm like, something is still not right. Nobody could really figure it out for me. I had to do some deep diving, and how, if you go searching for an answer, you finally will find it. It took me 20 years when I finally discovered functional medicine, and I was like, oh, this makes sense. Everything is grouped together. This is what it is. So, yeah.
Yeah, so when you finally figured it out, actually, even going back further than that, so when you were going through all this and you were having the cystic acne and you were having these excruciating, painful menstrual cycles, did you ever go see a traditional medical doctor to see if they could help?
So, no. Well, okay, let me not say no. I was seeing different doctors for different things. So for the acne, I was seeing a dermatologist, and they put me on some hardcore medications that I had to stop because some of them I knew they weren't good for, women who were looking to have kids, and I didn't want to be on them for so long. I tried birth controls with my OB-GYN, for my regular women's doctor. I said, hey, I have these extreme painful periods. Is there anything I could do? And she was like, oh, you probably have hormonal imbalance, without even testing me or trying to figure it out. She said, you probably have hormonal imbalance. I will prescribe you some birth controls. So she put me on birth controls. It helped with, I only took it for 3 months. I mean, as a pharmacist, I'm a walking, most pharmacists were like walking pharmacologists, like our head is just full of medications, side effects, benefits, risks. So
sure.
Taking those medications, I'm like, okay, birth controls, okay, what's going to go on? So I'm studying myself as I'm taking this medicine. Then I started taking the birth controls. I noticed that whenever I did finally get my period, it was extremely heavier than normal. It was like worse than what it was when I wasn't, on them. And I said, no, this is not natural. Like my body was telling me that, hey, I don't want to be on these drugs because it's affecting something. Even if you're having hormonal imbalance, this is not the solution because we are off. We don't like this. So 3 months after being on birth control, I stopped taking it and I started going back to my dermatologist. Now, I guess the tip of the iceberg was when I actually got married and I was trying to have kids, and I kept having multiple miscarriages. And I'm like, okay, I set up, putting the dots together. I'm like, okay, now we have a problem. This is a major issue because my body is not holding the babies long enough. And I was someone I was working out, I was taking care of I didn't have problems at that time with weight issues. I was eating right in my mind. And I just couldn't figure out, I wasn't linking it to diet or nutrition or anything like that. So when the word PCOS came to my mouth and I went back to my doctor and I said, hey, do you think I have PCOS? And she was like, well, we have to do this. And it was like within 10 seconds, she was like, well, you know what? Just go have your babies after you have them and you come back for tests and we'll see. So within 10 seconds, I was dismissed with like PCOS. It wasn't like anything she was interested in like pursuing any further. So I had to do my own digging. I never got diagnosed officially from a doctor saying, oh, you have PCOS, but everything was clear. Like when you read into it, I'm like, yeah, this is me. This is me.
Yeah, I think you just touched on one of the biggest issues with traditional medicine is that, we as traditional medicine doctors were taught how to treat symptoms, and maybe sometimes putting those symptoms together as when it comes to something complicated such as polycystic ovary syndrome, right? It's very difficult to really put the pieces together and forge that into an actual syndrome unless it's really at the top of your forebrain. And that doesn't happen all the time, especially now in traditional medicine where you're so, short on time with patients and you're trying to just basically crank through your day. It becomes a big issue. So I'm assuming that I haven't been in a clinic anymore, but I'm assuming polycystic ovary syndrome is still very underdiagnosed these days.
Oh, yes, it is. It's very hard to figure out if that's what is going on with you. And I'm in a community of so many ladies that are suffering from PCOS, and everybody they show up in different ways. They show up, some people are suffering from depression, some people are suffering from, maybe it's diabetes or weight gain or losing their hair or just having excessive hair where they have to shave every day as a woman. That's crazy, So some people are lucky enough to get diagnosed, that's maybe something that has been running in their family, and maybe a mother figure noticed and I was like, okay, why don't you get tested for PCOS? But most other people, most younger girls, they don't know that that's what they're going through. So it's crazy.
Yeah, and I think that, as when we come back from the break, I think it would be great to really get into what the syndrome really is, because we've kind of alluded to it. So stay tuned as we get back, and we'll talk about insulin resistance, hormonal imbalance, infertility, when and who should be thinking about it, about PCOS. Stay tuned.
To learn more about being a guest on the show or to ask a host a question, go to hcshow.net or email the show at info@hcshow.net to get your questions answered on the Healthcare Corner. Don't go anywhere. You're listening to the Healthcare Corner with Gavin Wiswell, Dr. Guillermo Castillo, and Dr. Mansi Shah. Welcome back to Healthcare Corner, where you're a part of the conversation with your hosts, Gavin Wiswell, Dr. Guillermo Castillo, and Dr. Mansi Shah.
Welcome back to the Healthcare Corner, everyone. And today we have special guest Ndidi Ehim, and Dr. Ehim is here to talk about women's health in general. But I think before we go into that, I think, Guillermo, maybe and Mansi, we start with maybe defining the terms of PCOS and insulin resistance and kind of what all those things mean.
Yeah, I think it'd be a good idea for our listeners to kind of hear what, because we've alluded to this syndrome. It's a syndrome. It's not one particular diagnosis. It's a combination of things that happen, right, Dr. Ehim? So can you tell us exactly what polycystic ovarian syndrome is and what are the components, and maybe who should be thinking about possibly that they could be suffering with it or dealing with it, or maybe the onset of it?
Oh, yes, of course. So polycystic ovarian syndrome is a hormonal imbalance caused by the ovaries. So, of course, this is women, because women are the ones that have ovaries. And what essentially happens is because it's an imbalance from the ovaries, it creates excessive male hormones. So a woman with PCOS would have unusually high levels of a hormone called androgens. And this would look like, maybe male pattern balding on the head, excessive facial hair. They would have insulin resistance. Most of them have weight issues. They suffer from severe cystic acne. They also would maybe show up like trying to have kids and it's hard, or if they do get pregnant, they're having miscarriages. And so those are some of the ways it appears.
Right. So we here on the show talk a lot about balance and how balance is so important. So it sounds to me like that polycystic ovary syndrome is an imbalance of these androgens, right? Because we all have, I mean, women also have, I mean, we typically think of testosterone as a male hormone, but women also produce it, right? So, but maybe in polycystic ovary syndrome, there's an imbalance of those male androgenic hormones like testosterone to the estrogens and progesterone. Is that correct?
Yes, that is correct. So women and men have testosterone and estrogen, but women who suffer from PCOS have an unusually high amount of testosterone, making the expression of their estrogen reduced. So, their symptoms show up like very male symptoms, pretty much, with the balding and the excessive hair, which those are like physical features. When you see them, you know that, okay, this is what's going on with me. But there's some other things that don't show up physically, and those you might need to do some advanced labs for. But just the things that show up physically definitely are those male pattern balding or excessive hair, or the weight gain. People are suffering from excessive acne. So those are like the telltale signs. When those start happening in combination of themselves, or, if someone is having like someone on their period, they suffer from extreme pain, cramps during their period, or some, they just don't have a period at all. It never shows up. I've seen women there, like, I haven't seen my period in 5 years. So that's what it looks like.
Yeah. So you said something very interesting to me. I mean, because you said, weight gain and insulin resistance. So is it the weight gain, causing the insulin resistance, kind of like you would see in a type 2 diabetic, or is the insulin resistance causing the weight? Is chicken or the egg is what I'm asking, I guess.
So the insulin.
I love it.
Yeah. So insulin. The side effect of insulin is weight gain. So someone who suffers from, if your insulin is resistant to breaking down sugars in your body, and what that means is whenever we eat, our body is supposed to produce insulin to break our food down. And so that insulin is what sends the food to different parts of our body. So if it's protein, maybe it'll send proteins to the muscle. If it's fat, it'll send them to our adipose tissue to stay there to, keep us cushiony and warm. If it's something, carbs, maybe it's sending them to where, energy is needed ASAP. But when we have insulin resistance, now whatever foods we eat, the sugars they just stay in our bodies. The food, it can't break down the food to go anywhere. So that essentially leaves us with a high amount of insulin in our bodies. And when that happens, it's leading to weight gain, because the side effect of insulin is weight gain. So.
Yeah, so this leads me to another question. So insulin resistance in the body usually leads to the pancreas. It means more sugar circulating in the blood, right? Which then signals the pancreas to produce more insulin, but you're resistant to it. So the sugars keep going higher, and there's more. Is this the same type of thing? This is exactly what happens in diabetes. This is what happens also in polycystic ovary syndrome, and does that eventually lead them to a diagnosis of diabetes?
Yes, eventually, if it happens for a long time, it will lead to diabetes. Yes.
Wow. So is this something, doctor, that if you have diabetes, you have a higher risk of getting then? So does it work both ways?
You're saying if you have diabetes, do they have a high level, do they have a higher chance of having PCOS?
Yes. That was the question. Yeah.
No, not really related. So the PCOS, the insulin resistance, will lead to diabetes. Now, if somebody does have diabetes already and they're a woman, because it's a syndrome, diabetes is just one part of it, right? They would have to look in themselves and see if they also express other symptoms that come along with PCOS. So just a singular diagnosis of diabetes by itself might not mean that you have PCOS, because PCOS, the word is a syndrome. It comes with other things. Now, if you have diabetes already, maybe the weight gain, of course, diabetes and weight gain, they kind of go hand in hand. Then maybe you also have issues with conceiving or something wrong with your periods. Then maybe you also have the excessive facial hair. Now you have a syndrome.
Right. And Dr. Rahim, and then to make the actual diagnosis of polycystic ovary syndrome, how does that happen? Is it a diagnosis based on a myriad or a certain number of these symptoms, or do you need an ultrasound also with that, say that, the defining those cystic ovaries?
Yes, an ultrasound will let you physically show that there's cysts on your ovaries. So when you see that, and then you also have symptoms that have been showing up for a while, those will lead to a diagnosis of PCOS. So in my case, and most women, it's hard because you don't know to go check your ovaries on the ultrasound. Most people actually discover this when they're trying to conceive or they get pregnant and your doctor's actually doing ultrasounds, that was my case. And they're like, oh, you have some cysts in your ovaries. And I'm like, what does that mean? So, yeah.
And is there any other consequences of the polycystic ovary syndrome that other than insulin resistance, that's systemic or that leads to any other organ damage?
So because PCOS, your hormones, if they stay imbalanced for a long time, other things could start happening. And one of the things that is really sad is it becomes like a mental health issue. It comes along with depression and anxiety. And I've seen women talking about suicide. They don't know why. That's very dangerous when it starts going to that route, because there's a reason PCOS comes about in most chronic illnesses, and it has to do with our nutrition. So when we have things going back into our bloodstream that make its way to our blood-brain barrier and start showing up like depression and anxiety, and they start getting anxious when they want to go out because of how they physically look, that becomes a whole different kind of problem.
Yeah. So we've alluded to a whole bunch of different things, right? Especially when it comes to the approach from a traditional medicine standpoint. And maybe from your standpoint, tell us, why is the traditional approach to polycystic ovary syndrome just not quite enough?
So I believe the traditional route to most of these problems and PCOS in general is because most doctors, they're really not alluded so much time to, really sit down and provide individualized care. It's something with how the insurance wants doctors to work that, prevents or limits the amount of, specialized care that they can provide. I think that's one of the reasons. And, earlier I said, when I mentioned PCOS to my doctor, within 10 seconds, she was like, oh, just come back. It was like, come back for another appointment. We're not talking about that today. So, and she was gone. That's why I said, any other questions?
I wanted to chime in here, Guillermo, Gavin, and Iham. Honestly, what she's talking about is a lot of women go through, because I had the same problem. I was told that my cystic acne had nothing to do with my diet, and I should just go on an isotretinoin treatment. Accutane is the brand name that we use usually, and that was the approach I was given. So I bet that's the similar kind of experience a lot of women are having, right?
Yeah, I think traditionally, like we said, is that, and from a medicine, speaking as a traditional medicine doctor, we're taught really well how to treat symptoms, right? So when you come in and you say, look, I'm having cystic acne, I'm looking at all the common causes of acne. And, you otherwise being an otherwise healthy, female, I would say, well, the most common causes are exactly something dietary that's leading to maybe a hormonal imbalance. The first thing that comes to mind is not polycystic ovary syndrome, right? So, I think, then you're so limited on time that you just start basically throwing remedies at that symptom. So, hey, how do I treat acne, right? So then we treat the acne, and then the acne doesn't get better. So then you're like, well, what else could it be? I guess then, so it takes a long time before you even get to the part of maybe we should check your hormones, right? Is there something else that we need to do? How are your periods? So that, your menstrual cycle. So that would take maybe 2 or 3 visits, which could be months apart, right? So that system is flawed, is what you're saying. This is from, I've seen it, I've been part of it, not that I agree with it, but it's really difficult to change. So how is that maybe a different approach to what you guys do in functional medicine?
So with functional medicine, the whole point of medicine is to find the root cause to a chronic illness, because we're using individualized care. And one benefit of functional medicine is most people don't need to use insurance to provide that care. So now you're cutting the whole, there's no time to, attend to you. Let me, just throw something at you, right? So with functional medicine, we're trying to find what is the problem, what is the root cause. And so as practitioners, we go through a whole deep diving of history and, from environmental, what are you exposed to nutrition, to what have you tried, everything. So it's very deep into that person as an individual, where it's different from just doing the traditional route of things.
Yeah, so stay tuned here as we get back from the break. I have my theory of what the root cause is to some of these symptoms, but let's get back to Dr. Heem here, where she'll clear it all up for us from the standpoint of functional medicine. Don't go anywhere.
To learn more about being a guest on the show or to ask a host a question, go to hcshow.net or email the show at info@hcshow.net to get your questions answered on the Healthcare Corner. Don't go anywhere. You're listening to the Healthcare Corner with Gavin Wiswell, Dr. Guillermo Castillo, and Dr. Mansi Shah. Welcome back to Healthcare Corner, where you're a part of the conversation with your hosts, Gavin Wiswell, Dr. Guillermo Castillo, and Dr. Mansi Shah.
Thank you so much, everybody, as always, for joining us here on the Healthcare Corner. And it's something that we can't do without our great sponsors that help us. And today's episode and this segment of the episode is brought to you by Verter Health. And they are your post-acute virtual care partner. So they specialize in remote care monitoring as well as for mental and physical health. So you can contact them at 855-745-8400 or visit their website at verterhealth.com. And I think that we also want you to go to our website here on the show, which is hcshow.net, where you can subscribe to our newsletter, get all the past podcasts, and just join the conversation. Like today, we're talking about topics that are meaningful and different, and it's something that when you are going through an issue, you then want to become an expert in it. And so this is, I think, a great forum for us, for our listeners to understand, hey, there are experts out there. There are people that have been through this, and especially like today, Dr. Ndidi Ehem, who is sharing her own personal experience. We can do that by listening to that podcast and sharing that. So now back to the show. We really, I think at the end of the last segment, we're talking about root cause analysis. And the interesting thing about the syndrome, I was researching, and it really wasn't until the early 1990s that the National Institute of Health really started giving some validity to this multifactorial, partly genetic syndrome. And so, Guillermo, I think I'd love to hear from you, Mansi, and Ndidi as well, on kind of your approach and maybe what the root cause is here.
Yeah, from my standpoint, it seems that a lot of conditions, as we talk about here, you guys probably hear us every week and are kind of sick of hearing it maybe, but a system malfunction, which is really what happens when you start diagnosing a disease, right? It's a system malfunction that's due to usually chronic inflammation, and most of those are related to, most of that inflammation is related to stressors, as we talk about here all the time, which include poor diet, lack of physical activity, increased stress, whether it's emotional, physical, environmental, and lack of quality of sleep, and in some cases, alcohol, tobacco, drug abuse also contribute to all that chronic inflammation. But I'm not so sure that's the case here with polycystic ovary syndrome. So, Dr. Heem, what do you think from a functional standpoint? What's the root cause of polycystic ovary syndrome?
Well, using functional medicine, I believe, and I will say this, it comes from the gut health. So diet, nutrition, and women who have successfully been able to reverse their PCOS started it with their nutrition, and they were able to turn things around. And that goes for most, chronic illnesses that I've seen, people who have successfully implemented, okay, let me change these things and do it this way. And so it's not just saying throwing the word diet or nutrition out there. There's actually a very specific and certain way it needs to be. And when you do it right, you will essentially be able to reverse that, chronic illness or PCOS, to be specific.
That's an individual thing, as you alluded to, right? I mean, we had a whole show here on genomics and more specifically epigenomics. So when there's chronic inflammation, like you said, related to most likely what you're consuming and that gut health, right? That changes that epigenomics, which then changes the way or which genes are expressed and which aren't expressed in your system. And if you have a genetic predisposition to this polycystic ovary syndrome, then there's a good chance that by increasing that inflammation due to your poor dietary intake, or maybe not poor, but just not adequate for you, it leads to the expression of this gene, which puts you now expressing this polycystic ovary syndrome gene and leads to the syndrome, correct?
Yes, I agree.
Okay, so you guys, and you and Monse, you can both chime in here because you guys are both functional medicine practitioners. So when you see a patient who comes in and potentially has this condition, what is your approach to not only making the diagnosis, but then how do you approach, how you're going to treat them or how you're going to recommend that they go change their lifestyle?
I think we both would probably have the same approach because we're both board certified from the same institution. So Dr. Ayam, I would say that we would want to look at their diet, their history, their GI mapping, what microbes and overgrowth they have, zonulin levels, right? And then you want to add more.
Yes, and essentially lifestyle is very important, and how basically first start with cleansing and detoxing, because one thing, if you understand gut health, is there are a lot of things that get backed up in our system, and that's where most of this inflammation stems from. So if you are able to cleanse and clear out the gut so you can accept whatever changes you're trying to make, I think that's the first step.
Yeah, and I think for our listeners out there who have listened to some of our previous episodes, the episode we had with Dr. Feurenstein, Joe Feurenstein is a good one because, and some of our previous episodes where we talked about leaky gut syndrome and some of these other conditions that, the microbiome and things that affect your overall gut motility and what causes inflammation. Would be good to review, and you're saying that this can lead to some, not just polycystic ovary syndrome, but a lot of these chronic diseases that are the root cause. Most of those, the root cause is inflammation, and you're just confirming what we talk about here time on the show, that inflammation usually stems from stuff that we're putting into our system ourselves.
Yes, our choices. Right? Every day we have a choice to make of how much we're going to sleep, what's our morning routine, what food we're putting in our body, what chemicals we're letting go through our skin, even like lotions. All these things lead up to whatever gene expression is going to get turned on or off. And if you're already predisposed and your gut microbiome likes to have the whole acne flora, then you're gonna go with a lot of problems that are a lot of women seeing in their younger age, and it all comes back to lifestyle.
Great. From a functional medicine standpoint, what's the biggest difference when you're approaching the female or women's health versus traditional just men?
Well, for me, the difference, I would say, is if I see a female that is talking about something that I'm going through, I connect more with that person. And it's also for the fact that a lot of studies don't have the chance, or they don't do, research on women, just for the fact that, they're careful about childbearing age, or women who are pregnant, and they don't want to do those studies. So it becomes very limited, the things that are available in regards to treatment to help women. But there are more options for men, just because men don't have that limitation in regards to, they don't, they're not the ones bearing children physically, or going through some certain things that women naturally have to go through. So when women are able to connect with other people who have been through what they've been through, and they've not been able to find the answer from other, outside sources or even on the internet, it's amazing when, you're able to get help from someone that understands exactly what's going on with you.
Yeah. From a traditional medicine standpoint, when we deal with polycystic ovary syndrome, and we see insulin resistance and maybe not quite diabetes, but we still treat them, right, with these oral hyperglycemic agents, sometimes even insulin itself. We treat, the hormone imbalances with actually more hormones to balance out those imbalances. The infertility has a huge workup. So when it comes to, from a functional medicine standpoint, the difference is, then tell us what, maybe it's not adding more pharmaceuticals, right? So you're treating with, you told us, food, and is there any other supplements? Is there some things that is this a more natural approach? Is that what you're saying? That maybe some people who aren't really into the traditional adding just more pharma would really go for?
Absolutely.
Yes.
Supplements are our go-to, right, Dr. Aham?
Yes, they are. And there have been a lot of studies that have been done that show that supplements that are high in antioxidant levels actually have reversed PCOS. So these studies actually were given high-grade antioxidant supplements to women who had PCOS, and then they gave like a control group placebo. And at the end of the study, those women who actually took the supplements that were high in antioxidants actually ended up getting pregnant. There was improvement in their metabolic symptoms, and they were able to reverse their PCOS compared to the women who were on placebo. And so that just shows you, either if you're supplementing, you're eating fruits and vegetables or foods that are colorful and very high in antioxidants, those tend to help. And that would probably be a starting point as well.
So, what I hear is that, this chronic inflammation is reversible, and maybe that gene expression can be suppressed, and that can lead to actually a reversal of the syndrome. So you're saying that in your experience, you've been able to cure people, or actually, get them back to normal levels of hormones and insulin resistance and all this based on just these type of treatments, which are dietary, exercise, decreasing stress, and lifestyle modification.
Correct. Yes.
Wow. So why isn't everybody going to functional medicine doctors? That's my question.
Some people see it as, okay, how do they know it really works? Some people believe that they just need to put a Band-Aid over a problem and that'll be it, or put a bucket under a roof instead of fixing the whole roof. And so people just are used to how it's always been. They've gone, it's probably a mindset shift that needs to happen. They've accepted that this is something that they're going to go through for the rest of their life. And, like it's publicized out there in the media. If you just take your medications, you'll be okay for the next 20 years, 25 years. And so, yes, every month, maybe you go to the pharmacy and you pick up your meds and you only pay $10 or $20 out of pocket. But if you add that up 20 years down the line, you would have spent more in your time, in your life, and the suffering that you go through daily where, medications can't even really manage you to 100%, than actually finding the root cause and finding a practitioner that could help you get to that solution faster with modalities and frameworks that will work in a short time frame. So you could go on with the rest of your life without having to worry about, okay, what's going on with my skin, or why am I having so much problems with weight? Why can't I conceive? All this kind of problems. So it's a mindset shift, and it's something that more people need to be open to. I find myself having to explain what functional medicine is to people who,
from my standpoint, functional medicine, and even in general medicine, women's health has been underrepresented. So as we get back, please don't go anywhere, because we're going to talk about why women's health is underrepresented and what we can do about it. So stay tuned. We'll be right back.
To learn more about being a guest on the show, or to ask a host a question, go to hcshow.net or email the show at info@hcshow.net to get your questions answered on the Healthcare Corner. Don't go anywhere. You're listening to the Healthcare Corner with Gavin Wiswell, Dr. Guillermo Castillo, and Dr. Mansi Shah. Welcome back to Healthcare Corner, where you're a part of the conversation with your hosts, Gavin Wiswell, Dr. Guillermo Castillo, and Dr. Mansi Shah.
Welcome back to the Healthcare Corner, everyone. And it's that time of the show where we're going to give our listeners 3 things that they can do to have a happier, healthier life. And here on the Healthcare Corner, I think we've revisited so many themes today about health and wellness and eating right and sleep and exercise, that sort of thing. But I think specifically we want to really identify how women can be better consumers of healthcare information and identify what we've been talking about today relative to PCOS PCOS and hormonal imbalance. And one of the best ways we can do that is, I think, get in contact with Ndidi Ehim, Dr. Ehim. So, Doctor, how will our listener base get a hold of you? Social media, what's the best way for them to contact you and learn more?
Yeah, so you can find me on LinkedIn, Ndidi Ehim. First name is spelled N as in Nancy, D-I-D-I, and last name is I-H-I-M. You could also contact me on Instagram and Facebook with the same name and spelling. And also you could reach me on text. You could text wellness to 832-400-6829.
Wonderful. Thank you for sharing that. And we'll make sure it's on hcshow.net as well as in our newsletter. So I think to recap today, Guillermo, let's talk about women's health and how we can get better educated and proactive.
Yeah, when we finished the last segment, we were talking about why we think, some of this is especially, syndromes like PCOS, but more specifically, actually, not even less specifically, more encompassing is, women's health seems to be underrepresented from a traditional medicine and even a functional medicine standpoint. At least I can tell you from a traditional medicine standpoint, from my perspective, we always see women as these stronger, sexual entity, especially like I grew up with very strong females in my life. My grandmother and my mother were strong, very determined females. And I know they were suffering with some of these hormonal imbalances, and I saw their mood swings. But they just, they were tough. They just worked through them, and they seemed to just always come through. So I think we still, even though we've come so far and we're, much more advanced in women, we've seen it much more as equals nowadays, we still see them as these tough individuals. And sometimes I think even from a medical standpoint, we pay less attention to some of these imbalances and some of these things that, women could be suffering with, but we see them as almost normal. Right? That's just my perspective. What do you ladies think?
Thank you for bringing that up. We definitely feel that way. I appreciate that, Dr. Guillermo.
Yes, I second that. We're strong beings, and we move and we take care of everybody else. But most women just kind of neglect themselves because they're trying to look out for everybody else.
Yeah, and I think we need to be a little bit more sensitive about that, especially us as males, who wouldn't be here without these females. But also, I think a lot of people out there also pay a lot of attention and still really have been raised and programmed to believe in this traditional medicine. And I think they need to know that there doesn't need to be individual. They don't, function in silos. They can be synergistic. And, maybe somebody with PCOS does have severe insulin resistance, and maybe at that point of maybe even diabetic, and maybe they do need insulin for a little while, right? But at that point, they could still see a functional medicine practitioner like you, Dr. Ehid, and then Didi, and still get, your recommendations, and in conjunction to what they're doing with their insulin, still work on reversing some of these symptoms, right? Just because they're on insulin and they've gotten to that point, doesn't mean they can't revert and go back to living a better, improved quality of life. Is that so?
Yes, that's correct. So they can definitely be reversed, and functional medicine can, some people also include it into what they already do. And if you give it time, it will work. So make sure you're supplementing, and make sure you're including antioxidants that are very colorful, especially the ones red, yellow, and orange into your meals. So those will help go in there and fight whatever toxins are causing what's going on, and reduce those, start reversing the illness. And also reduce stress. I'll say that, especially long-term stress, which increases the production of a certain hormones that makes everything else imbalanced. So
yeah, from a traditional medicine standpoint too, I was in a practice where when we found conditions that I didn't feel comfortable treating, we would refer to other practitioners, say a nephrologist, right? Say a neurologist for certain headaches, things like that. So I would like to see it to get us to a point where because of the way our traditional medicine practices, and we're not incentivized to spend time talking about maybe nutrition and their lifestyle and their stress and these things, what if we could then refer to a specialist like you, who then would take the time to really go after that root cause? Could we get to that kind of relationship between traditional medicine and functional medicine? And what do you guys think it would take to get there?
I think it's possible. We just need more open-minded medicine approach. That's what I would say, because the traditional approach that we have, where insurance doesn't cover these practitioners is not working because we have a lot more chronic illnesses and inflammation floating around. And it would be an amazing integrative approach if doctor like you, Dr. Castillo, would say, oh, I actually work with Dr. Ehem, and she's great at helping you with long-term results, but here's a prescription that will help you with short-term results, like maybe a clindamycin or something like, metformin to get started, or something that is just quick for now, but then the long-term result comes from working with someone like Dr. Ehem and me. What would you say?
Yes, I completely agree. It's not an antagonistic relationship. It could definitely be symbiotic, where the traditional medicine or functional medicine practitioners come together and work on the good for the patient. So I believe that.
And I think that's not the case now. I mean, at least from what I've heard out there, is some traditional medicine doctors think that you guys as functional medicine practitioners are competing with us for patients, which I don't see it that way. But I think it's going to take a lot of education, from a women's not just from a women's health standpoint, but from an overall, synergistic approach to really doing what's best for our patients. And obviously, like I said, traditional medicine, number one, we're not trained. Number two, we're not incentivized to give that kind of care that you guys do. So it's imperative that we get there, and I know we'll get there sometime. But I wish I could just speed it up. Like, I want to get there tomorrow, right? And I think
we need more doctors like you.
Yes, we do. Too bad they broke the mold after him, right?
Yeah, no, we can get there. It's just a little bit of education and awareness, just like it is with polycystic ovary syndrome. And most of us don't think about it. If it's not at the forefront of your brain, if you don't even think of it as a differential diagnosis, you're not going to work it up. Right. So same thing with this type of approach to medicine. I think that most doctors don't even have the time to even think that this is something that would work for their patients. And if you really have your clients or your patient's best interest at heart, then there's no option out there that should be crossed out of the list.
And I think my takeaway as a patient, right, and what I've heard, especially from Dr. Ndidi, is if you're feeling a certain way and the answer is you're not getting in traditional medicine, keep going, keep asking, right? I think my takeaway from your story was that you didn't quit. You continued to look for certain answers, and it took you, sadly, a couple decades to find that answer, but you found it, and how much better off are you for really continuing to ask questions? So I think so much in medicine, we take the answer of the hospital administration or the physician, right, just as the truth. But I think it's good to have that perspective in others. And so how do you help people, especially with these different types of syndromes, really continue to ask questions?
Yeah, that's it. So maybe, just to help our listeners out there, maybe you ladies can give them maybe 2 or 3 things that, they can do now from a functional medicine standpoint that can actually improve their overall health. Doesn't necessarily have to be related to PCOS, but it'd be great if it could. So.
Absolutely. Dr. Ehem, why don't you start and I'll finish?
Yeah, so definitely I would say number one thing is, like I already mentioned, make sure you detox, cleanse out your body from the toxins so that it can accept the new change you're trying to make. Understand nutritional labels, understand what you're putting in your body. If there's one tip I want to leave with everybody today is stay away from sugar. Sugar is toxic. It's like actual drugs, stay away from that. And try to, if you're going to exercise and you're trying to stay on a certain regimen, at least exercise for 150 minutes a week. So that looks like 5 times a week, 30 minutes a day. And just moderate, if you have PCOS, you want to do low intensity because you don't want to stress your body out to produce too much hormones that lead to more production of testosterone. So those are the tips I will leave you with.
Absolutely. And I would like to add, stay hydrated, because that really helps with the detox that Dr. Ehem talked about. We underestimate the value of water, clean water. So that would be my tip.
Yeah, I think there's a lot of, you guys covered a lot of great tips. And I think just in general health, when you say detox, for me, that's something that's, becomes somewhat painful in my gut. Like all of a sudden I think of, like a colon cleansing and stuff like that. But it doesn't have to be that way, right? So there's many different options out there. I think people should really get educated and think about what that means for them. And it's an individual thing. So I think maybe visit a functional medicine practitioner If it's not Dr. Ehem or Dr. Shaw, then you should definitely look for somebody in your neighborhood, somebody that you can connect with. And remember, it's for our standpoint, all this stuff when it comes to removing sugar from your diet, exercise, at least you said 150 minutes a week. That's not a lot. If you think about how much time you spend on your phone looking through social media, you could definitely take 30 minutes away a day, maybe.
Absolutely.
All right. So
Do it while you're on the elliptical, right? Kill two birds with one stone.
Well, I don't know. I think you should focus on one thing at a time. It gets dangerous. I can't do two things at the same time,
That's
Gavin.
why I'm not the doctor.
I just can't. It's complicated. Yeah. And you said low intensity workouts, so that's very important. I think for people who are going through anything like this where they're hormonally having an imbalance and maybe adding stressor, because that's a physical stressor, but still a stressor, right? Can really change the hormone levels.
Yes, because your body doesn't know, what kind of stress is happening. It just knows that something is going on and it's stressing your hormones. So what it does is it produces more testosterone to support the stress that's going on.
So thank you, ladies. I really appreciate you. I think that women's health is still one of underrepresented systems in our traditional healthcare system, maybe in functional medicine as well. But I think today we covered, we think that it's education that's the answer, and I agree with you. And I think also just educating our physicians and putting it out there that that's actually a possibility. I think that a lot of traditional, especially family medicine doctors like myself, would out there, if they knew they could refer to you, would make a big difference. I think that we would be willing to accept any help that we can to do what's best for our patients. And for everybody out there who's thinking that maybe you're suffering with some of these symptoms, maybe hormone imbalance, maybe infertility, maybe, like I said, excessive facial hair, doesn't necessarily mean you have polycystic ovary syndrome, but maybe you are suffering from a hormonal imbalance that these functional practitioners could definitely help with. And please ask your doctor. We will be here next week again with another topic and ready to help you live a better life. So until next time.
Have a great weekend, everybody. Thank you.
Thanks for joining us for Healthcare Corner, where your healthcare and safety are always top of mind. Tune in next week at this same time for more of the most relevant topics that can help you and your loved ones feel safer and more informed about what's going on in healthcare. To learn more about Gavin and Dr. Castillo or how to become a guest or sponsor of the show, send an email to info@hcshow.net. That's info@hcshow.net. This has been Healthcare Corner on The Answer San Diego.